My name is Charlie Nahadebian. The name of my company is VideoKall. ClinicStop is a robust AI robotics telemedicine platform. Let me tell you a short story. My parents came from Armenia as young adults to avoid the genocide. I am one of 8 children, and I was born and educated right here in Boston. My mom did not drive. Every time we got sick, Dad would close the store and drive us to the next town to see the family doctor. Even then, I knew there must be a better way to get health care. That is why VideoKall was born. The slide works. Today, except it went to, All right. We'll just skip that one. Today, providers and customers have challenges. Hospitals have financial pressures, especially in treating seasonal and chronic illnesses. Physician shortages are expected to continue to rise. There are more patients with chronic illnesses. Average wait times are about 18.5 days on average. And patients are not satisfied, and premiums, they're off the chart. The solution is ClinicStop, the next generation platform that facilitates high-quality medical care for minor and chronic illnesses globally. As a patient, you log into your account on any device. Cabins would be located conveniently in your neighborhood. You enter the cabin for an on-demand virtual video visit with a live medical person. You're guided to use the appropriate medical, clinical-grade devices. A visit is comparable to seeing a nurse practitioner in a doctor's office or a clinic. After the diagnosis, a course of treatment and perhaps a prescription are provided, and after you leave, the cabin and the equipment are sanitized automatically, and your health records are updated to the hospital system. The fee is only expected to be $65 versus $90 for a mini clinic visit. The instruments are remotely controlled and directly monitored. Connection to the healthcare provider is through a flexible, secure broadband network that can use satellite, internet, or cellular service. And there are benefits to healthcare providers. A call center could have a few nurse practitioners serving many more cabins. 24/7, alleviating the doctor shortage. Profitable revenues are provided, and they achieve lower operating costs for meeting this segment of the market. There's better market coverage, better penetration, and now competition in providing these services. Referral for patients needing more medical care can also be provided. So what's our secret sauce? All of the features in this platform you see listed allow us to eliminate the need for a physical attendant at the cabin. Our broadband network facilitates the use of nurse practitioners. Next slide. The telehealth market is growing rapidly. We do have competitors. There are the open kiosks where you can get your blood pressure, for example, but we have a closed cabin and a full array of vital signs instruments. Or you can call using an app to wait for a callback for a doctor's advice. They use patient-provided data, and ClinicStop provides directly read real-time measurements. And we're comparable but less expensive than a mini clinic. And even after all this time, CVS only has 1,100 clinics for their 10,000 stores. Next slide. Our revenues are from sales, leases, maintenance contracts, and recurring patient revenue. The annual cost for the cabin is about half the operating costs of a mini clinic. Next slide. In 2 verticals, in 5 years, we expect revenues of $150 million and the opportunity is tremendous because we're looking at other market segments. Next slide. The initial funds of $1.2 million at this point are needed for beta testing and customer trials, and with Series A of $5 million will be operational in 9 months. We're excited about our progress. We have a prototype, 80% of our software done, and a bunch of patents. We have an LOI for a trial, and we have partners for other segments. Thank you.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology, Boehringer Ingelheim, passionately working to improve healthcare, NASCO, advancing digital health together, in healthcare today and telehealth and medicine today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks to Seaport World Trade